Okay, we're going to bring tonight's meeting to order, and I will start the meeting with the chairman's general announcement. The Board of Health is recording. Is anyone else recording? We're good. All right. So we are going to begin the meeting, and tonight's meeting is being held virtually through a Zoom webinar pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law. So the first item on our agenda tonight is the approval of minutes, and we have several minutes to approve, I believe. So the first one that I have is the minutes from December 21st, 2020. Are there any changes or additions to the minutes?
No, they look great.
Okay. Can we get a motion to approve the minutes as written?
I motion to approve the December 21st, 2021 minutes as written.
I second the motion.
Great. So roll call vote. Christine Johnston approve. Katie Jobbins
Aye.
and Rebecca Torsha.
Aye.
Great. Okay. Second item. This would be to approve the minutes from the Thursday, January 6th meeting. As written. Again, thank you very much for putting these together. Any additions or changes?
No.
Okay, can we get a motion to approve these minutes as written?
I motion to approve.
I second.
All right. And Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
Great. And last set of minutes, looks like Wednesday, January 12th, 2022. Any additions or changes to these minutes?
No.
Okay. I can make the motion to approve these.
I
I
second.
second.
Great. And Christine Johnston, aye. Dr. Katie Jobbins
Aye.
and Rebecca Torsha.
Aye.
All right. So minutes all approved as written. Folks, do we have anybody here for public comment tonight?
Just kidding. No one's raising their hand.
Okay.
One
Nobody
did, but
can-
then it went away.
Yeah.
Okay.
If somebody wants to talk for public comment, please raise your hand now. There's no one.
All right, great. So moving on, business at hand. First thing on to talk about is the regulations for refuse and recycling collection, which we discussed a couple of meetings ago. Is there anything that we need to be filled in on, Tammy or Alex?
Nothing new from the last time we talked. I just figured you guys probably by this point had a chance to look through it and mull it over. I do think that come the fall, we're going to look at it again. There's some, I guess we can get some points if we adopt the model regulation, but I think for now, just to adopt the language to reflect what's coming up this year for this particular regulation is really all we need to do for right now. Liz is working with the haulers now to get them all permitted for the year. And then she's setting up, I'm sorry. I put so many little notes and post-its on everything like that. She's also had set up a training for, I believe it's May. Was that what it's May, Alex? Yeah. To let everybody know about, to help everybody conform with the new regulations come November. But there'll be more information forthcoming on that.
So now we need to just make a motion to approve the adoption of the regulation,
The amendments.
the amendments. Okay. I motion to approve the amendments to the haulers and refuse and recycling collection regulations.
And I second that.
Muted. Okay, so Christine Johnston, aye. Katie Dobbins,
Aye.
Rebecca Torsha.
Aye.
All right. Okay, Tammy, we have COVID-19 update. Tell us a little bit. I know we got your data, but tell us a little bit about stuff, including, I know there was the vaccine clinic and then also the distribution of masks and at-home tests today.
Can I take it back one step and
Please.
just welcome Renee Sukal to our new group. Renee has come on last month as our admin assistant, and she is learning quickly, and it's trial by fire, right, Renee? Yeah. Just in case anyone was wondering about new faces. Okay, COVID. Let's see, oh, I was gonna say, I didn't save this picture to share on my screen for here. I'll share it with everybody. Let's see. Hold on one second.
While you're doing that, I can talk about the data just that I got today, if that helps while you're doing that.
Yeah,
Yeah, so I can talk about what I got, the latest update I got today. So from Massachusetts standpoint, we are currently averaging down again, which is great, 40% from last week, only 3,000 cases per day, which is dramatically better. Hampden County, though, however, is still higher than the rest of the state, but it's still improving, which is all good news. And our hospitalizations have gone down to about 1,300 per day in the state. And that in Hampden County alone, that graph is good, but it's still higher than the eastern part of the state, mainly driven by our lower vaccination rate in Hampden County, which I know we're going to go over later. And then the hospitalizations at Bay State are down about to 147 in the hospital, which, just to put in perspective, is still higher than our first and second peaks were. We peaked at around, or it's still comparable to the first and second peaks, so we're still higher than we want to be. And we have 18 in the ICU, but that's again down 26%. So you have to remember, this peak we were dramatically higher than we had ever been. So the fact that we're down this much is really, really good news. And looks like the rolling average in the last 7 days at Bay State is only 6.7%, which is dramatically improved as well too. So this is all good news. And then the data about the flu, we've had no hospitalizations for that since the advent of so if you looked at the curve for flu, it was mirroring what it had looked like the year before the onset of COVID. But then when Omicron came out and everyone started masking, it dramatically dropped. And so that's all good news across the state, and especially in Hampden County.
Alex, can I share my screen? Or can it be enabled? Let's see. Okay. It says host disabled.
The only options that I have under more are nothing about sharing screen.
Oh, you know what? It might be in this mode. Maybe I'd have to be a host. That's okay.
So I believe it's because we had to set it up when you make the meeting that it has to have that before it's created. You might be able to change it, Alex, if you go to settings.
I guess webinar mode's a little different than.
Yeah, it might not let you.
It's all right. You're gonna post it anyway to the Facebook page and everything tomorrow. But I just wanted to show what the graph of what it looks like right now, and just how January really just jumped out at you. But on the other hand, like how it just went straight down, which not quite mirrored the way that it went up, but it was very similar coming down than it was going
Oh, wait.
back up, going up.
Let's see. I think you can share now, Tammy.
Let's see.
Are you able to?
Desktop. Here. Oops. Is it sharing?
No.
No.
Says all panelists are able to share.
It's really just giving me an option to share desktop.
Are you able to pull it up on your desktop and share your desktop?
It is on my desktop, yeah. Okay, so maybe this wasn't the week to get fancy. We'll have to see how that. Oh well. That's all right. I just verbally described how wonderful it was. There's a star on it even to show us where we are. Anyway, so last week's reporting period, we were at 248 total cases. And this week's 14-day reporting period, we were at 169 or 170, depending on which source you're looking at. That puts us at 14.08%. 32 were pediatric, under 18 and under. 44 were 65 and older, and the average age was 46. And of those cases, 95 were vaccinated and 47 were boosted. Also in that period, the school department had 4 positive staff and 18 positive students with only 1 close contact, which is awesome. That's amazing. So this was the reporting period that ended on February 5th. I just also went into the system to pull up basically who today in town is positive, but obviously these are lab, these are test results that have been put through lab. These are not home test results. But as of right now, with those reported results, there's 21 positive cases. 2 of them are in children, and that's a big difference than what we've been seeing. If you a few weeks ago when we spiked in the 600s, the majority of our cases were children. Now we're looking at much elder population. Like I said, of those 21 people that we now have in isolation, and this is not through home testing, only 2 were kids. And we're seeing 80s, 90s, and beyond even. So the numbers are looking different. They're looking good in one aspect, which is great. When talking to the lead nurse for the school, she was just really excited that they got their numbers, their numbers are manageable, and that the case contact was 1 case contact. So that meant 1 potential case in the school system from those positive cases. So that's looking great. So on that note, the school is continuing forward with trying to start up the test and stay program. But they did apply to do symptomatic testing at school, and also to do the home test kits. So that when that goes through, then the test and stay will stop. So if you were to think about the test and stay right now, what impact would it have had if it was in place this week? 1 person would be in that program, that 1 contact. So that's looking pretty good. The vaccine numbers, let's see. The vaccine numbers and the test numbers this week, they come out at 5 o'clock on Thursdays. So it's like right before our meeting, so I can't print them off when I'm here. But they look pretty similar to last week. Let me get my.
It was great to see, though, even from the last two reporting cycles that the 5 to 11 age went from, I think it was like 33 to 46% with their first shot in the 5 to 11, and then 21 to 35 who are fully vaccinated in 5 to 11, which is great.
Yeah, so this week they're at 36% fully vaccinated for the 5 through 11. 12 to 15 went up 1% to 69%. It's funny, that wasn't enough though to boost us past 69% as a total. So we're still hovering at 69%. But maybe Monday's clinic might have made a difference. I think we had 51 people came and got vaccinated. We're up a little bit. We're at 30% now boosted in town. Still working on, so we had the clinic on Monday. I'm going to work with the senior center to try to do something else for another booster, because I believe they're eligible for a grant to do some other supportive services while we're doing clinics. So that'll be great. I was trying to look for the Vax bus, but I thought that would be great, because I just like, if you saw a bus just standing there on the side of the road, wouldn't that be such a great opportunity? But I guess they're not really doing anything in Western Mass anymore. So just trying to, talk to local partners, see if anybody wants them, see what part of the community feels like, that we're missing in that sort of fashion to keep going. So on the vaccine front, let's see. So Moderna's vaccine, the Spikevax, has just been approved for full vaccine approval instead of operating under an EUA. It really doesn't mean too much for the average person. It's still only available 18 and up. And also FDA is now considering Pfizer vaccine for children 6 months to 5 years. And I think that meeting is maybe February 15th. And then after that meeting, if that goes through approval, that'll go through the APIC, through the CDC's program. And hopefully maybe it will be recommended. At this week's local public health meeting, our state epidemiologist, Katie Brown, says there really is, there's some great evidence in the test studies that have already been taking place in those age groups. So we'll see how that goes. I feel like I went through that faster than I thought I was going to.
Also, thank you so much for posting the update about the benefits of boosting. I know, Alex, you posted this about how when you're boosted, your risk of death goes down dramatically, which was huge. And that's, I think, a really important fact for people just to know as well, too. So I think that's great, that we've had so many people who have shown up to be boosted or even just get their first rounds of their vaccines as well, too.
Yeah, in the higher ed population, we're extraordinarily vaccinated, but mediocre on the boosting. And what we're seeing, we're still seeing cases. We are a highly densely populated environment as a residential institution. And we're also testing a lot of people that wouldn't otherwise test on their own because they have to for us. And so we're seeing a ton of asymptomatic cases and very, very mild symptoms. So in our population where we're seeing pretty much everyone is vaccinated and many people are boosted, very, very low level of illness. I'm talking students that, I wouldn't even have thought it was a sniffle for a few hours. And
it's so interesting too, like you said, the symptoms. My son had COVID and is fully vaccinated, but he had a head cold, but it didn't go away. Like it lasted for much longer than a normal one. And that's, I think, what I'm seeing also in my patients as well too, is that the residual symptoms, if you are vaccinated, the likelihood that your sense of smell and taste are gone and come back, it'll be less than if you weren't, vaccinated, that you'll actually regain that. There is a chance, obviously, of the residual cough. But the good news that also came out this week in Massachusetts is now anyone who's diagnosed with COVID can be prescribed Paxlovid to Walgreens by any of their primary care physicians. So it is a treatment now that you do not need to go to a center to get. You can go to your local pharmacy to get it. So if anyone tests positive, please reach out to your primary care physician or advanced practitioners because they can prescribe this as well too, which is a huge step forward in the treatment of this. And it's very, very effective. And it's a pill instead of an infusion. So it really is a game changer for how we're going to treat those who do contact it.
I think you bring up a really good point too about reaching out to your primary care provider. While the health department does provide help and assistance with people managing through any aspect of COVID, the person that knows you or your child the best is your primary care provider. So if you have questions, by all means call us, but I think you should always place a call to your primary care provider, because they would know your situation better than we would. And we still received quite a few phone calls, which we weren't sure like what way it was gonna moving, especially with the home test kits and whatnot. But we get a lot of phone calls. There's a lot of question about if you take a home test kit versus a PCR kit test. A lot of people might get one result one way and a different result another way. And you just have to make the decision that's best for you and your family. And also, like I said, calling up your doctor, I think is always a great resort.
Tammy, you were able to get home test kits, right? And we distributed
Yes.
them Monday and then again today, correct?
Yep, today on Monday, we distributed them at the clinic or downstairs from the clinic at Birchland Park, and then again today with the senior center. But I guess we still have some open. If people are interested and haven't picked one up, they can feel free to call the health department, and we'll put them on the list and find a time for them to pick up their kits.
Great. I'm glad that folks were able to get those.
Yeah, it was a long time coming, and I'm really happy that people were patient with us, but we finally received them, and we just want to get them out to people who need them.
It's never a bad idea to have some in your house.
Yes.
And now also after the 15th of January, if you do purchase your own, you can get reimbursed for them through your insurance company. Each one is very different, but there's like a form that you get, and they'll reimburse you up to 4 as well too, which is great.
And you can also go online and get them. Each household is eligible to get a certain number just sent directly through them. So that's an option too for folks.
Yeah, you can get 4 of them. I did the link a few weeks ago and still waiting, but yeah, you can get them delivered to your house. So
It seems like I'm hearing people in different states or different parts of the state are kind of getting them. So I think if people are just patient, and I think I think Western Mass is probably on a schedule, but we just haven't really received them yet.
I know some people who have, and other people who haven't. And it's just, I think it's just, they're just going through as they came in.
Well, we know it takes a while to get your mail. So
That's true.
anything else on the cases or the vaccination rates? Thank you so much, Tammy, for all that data.
Yeah, no, we're slowly going up. We're still higher than the county's rate, which is about that 63% or 66, depending on which numbers you're looking at. So we just can, want to keep pushing on, trying to find ways and make it accessible to people. We still haven't received that grant from the Mass Health Officers Association yet, but one of the things that once we do get it, we might be able to do is help our initiatives with getting people vaccinated. Still waiting on that though. We can move to the announcement from DESE and DPH that they are going to be ending the mask requirement at schools on February 28th for K through 12 and childcare settings. That just went out yesterday. Don't really have much information on it than that, other than with the numbers going in the right direction and with other states moving in that direction as well. Massachusetts is following with them.
So there also is a little line that no one talks about, which they did include, that if you are not vaccinated, you should still be masking indoors. Although everyone is focusing on how this is lifted on the 28th, they are not talking about that part, which I feel like is something that it's important for everyone to be aware of that fact. This is still highly transmissible. It is the week after February break in Massachusetts, where a lot of people are going to be traveling, and that they also did put a comment in, if people are choosing to continue to mask their children in schools, to be respectful of that and to recommend that their children be respectful, because the last thing we want is for children who have been dealing with enough of emotional trauma the last 2 years to have to deal with that as well too. I would recommend having conversations with your children about this as well. You know, I've already had one with mine, about being kind. And that's the most important thing right now, that, you know, people are going to do what their family needs to do and be respectful of what other people are doing, which might be different than what we are.
Then this also doesn't, this doesn't change the isolation and quarantine guidance, especially the masking portion. So if you are on days 6 through 10 of either your isolation or your quarantine, you are still masking, you're masking at school. And if you cannot, your quarantine or your isolation is going for the full 10 days. So that's
There's
something to be aware
also
of.
a line in there about busing, I believe, that due to federal guidelines, this does not change masking on busing. So
Yes.
it's important that folks know that to get on a school bus, children are still, of all ages, children are still going to have to be masked on the bus.
And the bus drivers as well too.
That's great.
So that will still be in place. And I feel like I know that there's probably way more on COVID related. It's like we live it all day, every day. But those are my highlights that we have.
And just to review our mask mandate, we had the same expiration date, the 28th, correct as well?
Yes. And talking to some of my colleagues in Hampden County, most people, they seem to be going with the 28th as well.
So I just want to understand from a protocol assessment, do we have to do anything on the 28th, or does it expire and then it goes away, or what happens with that?
It expires on the 28th.
And if I know last time we made a mask advisory after the mask mandate ended. If we wanted to consider something like that, again, we'd have to have another meeting to kind of discuss that and then vote on that, correct?
I'll check on it, but I in the language on our last meeting, did we vote to rescind it and put it in its place, or did we just vote to we just voted for the mask mandate? I'm thinking that's
We still have the mask advisory in place
the
behind
mask
it.
advisor is in place. Yeah.
The state also still has their mask advisory in place as well.
Okay.
Yeah. We can just refocus on that.
So we wouldn't need to do anything. We wouldn't have to have a special meeting. The 28th, it would just end, and then we would go back to our mask advisory.
I am 95% on that, but I will make sure that,
That would be great, Tammy. Thank you.
yeah.
And I would love to see us do some outreach work with the school system on some of those points that we just talked about, right? About the busing. So people aren't surprised when their kids are like, you know, getting to get on the bus and they're like, hey, where's your mask? Or the days 6 through 10, and just the choice of families have, that everybody has the choice to be able to continue to mask for whatever reason you want to do that, do what's right for your family. So I think really doing a partnership information campaign with the school system is going to be super important.
And recognizing that there are children who have autoimmune disorders or immune suppression, they're undergoing treatment for cancer. We want them to be able to go to school and be around other children and feel safe being at school. That's our goal, is to keep kids in school and to have them be around their friends. So how we can do that in a safe way is really, really important. And also recognizing too. So I wanted to get clarification about this. So technically, if you are in day 6 to 10 and you are unmasked, you are not supposed to be within a certain feet of someone for more than 15 minutes unmasked. Lunches in the middle school and high school are together, correct?
I believe so.
So how can we have an unvaccinated child who is COVID positive eat unmasked in a room with other people? Because it's 20 minutes at least for lunch.
That's a good question.
Can we look into this, please? I realized this when I had a child who was in middle school who got COVID, and I chose not to send him on day 6 through 10 because I didn't want to be the parent whose child was a super spreader at lunch. And he's vaccinated, you know, so I think it's just something we need to clarify.
Yeah, at the college, we're still using 10 days because we physically cannot have, we don't have enough space and distancing and residential living and dining services, because on those 6 through 10, I know you're not supposed to eat in a restaurant.
Correct.
And so a dining hall really fell under that for us. And so we were, yeah, that's a great question, Katie.
And I didn't think about that until I had a child who fell into that category. Whereas my kindergartner eats in his classroom at his desk. You know, I know we don't have the luxury of space in our middle school and our high school. And that's something I think we need to be very thoughtful of now that we're moving into this next phase.
It's a very good point.
Believe me, I want this to be over as much as everybody else, but we need to just be safe.
Yeah, I mean, up until this point, unmasking during lunch was the only activity allowed during that period where you could take your mask off. But going into this sort of new phase, that's a good question to see. And if it's not something that that we can understand locally, I'll put it to Desi as well.
I mean, and it's not something that's brand new as of tonight, right? Like this is since the isolation protocols changed, something that somebody's been thinking about. Obviously, Katie has.
Yeah,
I mean, it never crossed my mind until it was my own kid. And I'm like, well, how long is your lunch? And where do you sit? And I started just asking additional questions. And if we don't think about this and ask, then we'll never know the right way to advise people.
and until now, the guidance really was just masked except when having mask breaks or during lunch. But they don't elaborate, at least.
And I think every school system is different with the spacing as well too. So I think it's really important to recognize, you know, for our K through 5 or K through 4, whatever it ends up being, where they have the individual space to eat their lunch and they're not even within 3 feet of each other, that's fine. But if, you know, they're in the cafeteria and they're sitting in seats and they're near other people or across from people, that's not enough space. And just making sure I want to make sure our parents in the community know what this guidance looks like and how this actually can affect their children so they can do it in a way that they feel like they have enough education about how they want to send their children to school moving forward at the end of the month.
I will look into that and report back to you guys, because now that's a question that's popping in my head as well. Anything else that's on everybody's minds?
No, we have next is just other business on our agenda. So anything else that we need to discuss tonight? I know spring is going to be coming soon and we'll start talking about mosquito control and all sorts of other good public health stuff coming up outside of COVID.
So I have one question, and I don't know if it falls under us or if that's the DPW, but I'm just thinking about like safety with the ice skating now that we've had a lot of freeze and thaw cycles at Heritage Park. Are there people who like say whether it's safe to skate?
Fire department usually does.
They do an assessment. Okay. I was just thinking about it because my kids asked if they could go skating. I'm like, nope. I'm like, it's 40 degrees. But okay, so there is someone who assesses that. That's awesome.
I mean, we had such frigid weather for so long, and then all of a sudden this icky thaw.
I've fallen 3 times. I'm so happy about these freeze thaw cycles.
Oh no.
So we just need to do our next meeting. Christine, you're muted.
All right. I'm so good about muting so nobody hears the like chaos that's going on in my house and then forget to unmute all the time. So if we have no other business, we have a regular scheduled meeting that we would need to schedule, which would be our March meeting, correct?
Well, there needs to be a meeting scheduled within 21 days
Yeah,
of
so-
February 3rd.
Okay.
So if we want to schedule for next Tuesday at 5.
I can do next Tuesday at 5.
I'm pulling out the calendar. I think I
That
said
works
I could do
for me
that.
too.
I will juggle a 5-year-old potentially, but I'll be there.
Well, that will be a quick
Yeah.
meeting, hopefully.
Okay, Tuesday at 5.
Okay.
All right, I'll be like running home right at 5. I'll make sure to make a point to leave work. Get to pick up and then get home. Okay, great. So we have that. And then do we want to schedule a March meeting at this point?
And that one, it doesn't matter the time frame, right, Alex? That can be any time in March. It can just be whenever it works for us. Okay.
That's
Okay.
correct.
So now, Rebecca, when do you have your course?
So my course is asynchronous. So it can be anytime. Yeah,
Okay, great.
yeah, yep. So anytime is fine.
Is there a week of the month that speaks to you guys?
The second week of the month, my husband and I usually have some meetings that week. So that one's the hardest, but I mean, we can make it work. Especially while
I
we're
have
still
lots
Zooming.
and lots of meetings and it changes every month. So I just have to like kind of pick around. But I could do either, if we want to do from 6 to 7, I could do the 8th, the 22nd, or the 29th.
I can't do the 8th. So the 22nd or the 29th. Rebecca,
Either one works for me.
should we aim for the 22nd?
21st is a holiday for us, so maybe the 29th might be better. Oh, no, I'm thinking of this
Like,
month.
what's the holiday on the 21st?
Thinking of President's Day, just kidding.
Right, do we want to do the 22nd then?
Mm-hmm.
Okay.
What day does that fall on?
Tuesday.
Tuesday. Okay.
I'm trying to figure out, Tammy's got her
Yes.
fun children activities Monday, Wednesdays.
It would be easier if there was somebody who around to pick him up when my husband went back to school. Does the 4th Tuesday sound like a day that we could, or do you like going to?
I can't
month.
commit to the 4th of
Okay.
every, yeah, I have to look month to month just because I'm on so many committees nationally and locally. I can't. I wish it was that easy.
Okay, so March 22nd at 6 and Tuesday the
15th?
The 15th at 5
15th.
o'clock.
Yeah.
at 5 o'clock. Okay.
I'm opening up my calendar and I'm like, why doesn't my child have school on some random Friday? But don't want to scare anyone. That's not the public school system.
And we got
And-
the winter break coming up.
Just
Yay.
a quick thing, I received, so I got the Zoom and then I got a Google Meet. Like 20 minutes before we were supposed to go on. And I realized,
Oh.
so I'm like, we always do Zoom. Let me pop back to
You know
Zoom.
what? Because you accepted my meeting invitation,
Ah,
it gave
and
me
I
the
never gotten a
reminder.
meeting. Okay, okay. No worries.
I just wanted to make sure everybody had seen it, so I put that one out.
Okay,
Yes, no, it'll always be Zoom. But on the invitation, Google Meet always adds that for some reason.
oh, okay,
So it makes some people confused, like if you meet in person and then all of a sudden they're trying to find you virtually and it's not there. Yeah.
Now we need to motion to adjourn, right?
Correct.
I make a motion to adjourn.
I second the motion.
All right. I for Christine Johnston, Katie Jobbins,
Aye.
Rebecca Torsha.
Aye,
All right, ladies, we'll see you next week.
All right, take care.
take
Happy
care, bye-bye.
Valentine's Day.
Thank you,
Yeah.
same to you.
Bye.
Bye.
Get the recording off. Do you know how to do that? Maybe not. Maybe we just leave and it stops.